Just to start, I wanted to basically introduce a little bit about why we're doing this. So, I have a TikTok channel that I host. I get a lot of questions from parents about things that I really don't have answers to as a parent. I do have, from a parent perspective, a view on it, but these are parents of kids who have a kid with autism or are concerned about their kid. They may be in therapy, they may not be in therapy, and I'm getting questions from all over the world. So I wanted to try to bring some actual experts to the table here. And a couple of things that I want to share just before we get into it. I have two great experts. We'll have you guys introduce yourselves, and then I'll give a little bit of an intro, and then we'll jump right in. So, Jen, maybe just start with your background, and then Sophie, go ahead.
Sure. I'm Jen Cummings. I'm head of clinical quality and outcomes here at Frontera Care. And I'm a BCBA and a PsyD, and I've been in ABA for over 20 years now. I also am a sibling, so I have had that family experience, and a lot of my approach stems from that family experience. So happy to be here and to be as helpful as I can.
Right, Sophie.
Hi, everyone. I'm Sophie. I am a BCBA as well, and I'm one of the co-founders at Compassionate Behavior Analysis. And we operate a slightly different model because we're all BCBA led, and we do all of the direct work with our students or learners, clients, whatever you want to call them. And we really focus on helping to solve academic, learning, cognitive, intellectual challenges. That's really our area of expertise.
Very good. And I will share again, I'm a parent of a child who was diagnosed with autism around the age of 2. At the time of the diagnosis, he was nonverbal and didn't respond to his name, had repetitive behaviors, a whole series of things that we then did an ABA intervention, a pretty intensive one, along with other interventions. And over the course of a year or two, my son began to speak, his behaviors began to change. And over the course of 8 or 10 years, he transformed quite a bit to the point where eventually we enrolled him in Sophie's program. So I met Sophie. And Sophie specializes in generative language therapy because we were interested in increasing his vocabulary and his language because it had come quite a bit of a long way, but it still wasn't conversational. And of course, autism is a social communication disorder. So what we want is we want to generate better social communication skills and offer those to the child. So Sophie's program was phenomenal for my son, and he did gain quite a bit of vocabulary and language in that program. And so it was a process of getting to that point. And I know a lot of parents, I hear from you, and you ask about my child is nonverbal or my child is pre-verbal or what are the things I can do? What are the therapies and whatnot? Look, we're not offering a therapy here. What we're offering is some insights that you can then take away and decide what the next best step is. And I just want to share one other last thing, and then I'm going to hand it over to Sophie to talk a little bit about generative language. But basically, for me, the journey was a pretty long one. And a lot of parents that I interact with are maybe in the frame of thinking, look, I'm in therapy. Why am I not seeing results? You may be getting results and you just don't have the data that you need, right? Or you may not be. And I think a big part of this is getting the right information when you're in therapy as well. And what I learned is that a lot of times there were changes happening with my kid that were imperceptible to me. And they were actually happening, but I didn't see it until it really happened, right? So it was sort of like hard to stick with that when you're doing so much therapy and there's so many other things going on, and you don't immediately see a result. But the results take time. And over 10, 12 years, I posted a bunch of videos of my son. You can see the changes, right? So I just want to like share that journey so that people who are in the thick of it and they don't feel like they're seeing a lot of results, you stick with the therapy because that is the right intervention. There's a lot of BS and other things that go on in the autism sector, but the proven therapy models do work. They don't work the same for every single kid. They're applied in different ways, but they do work. So that's just one other message I want to send. So, Sophie, if you could maybe just describe the way language acquisition, happens with the kid, how your generative language therapy works, and what is the data and information that a parent should seek, like as they're going through the therapy to see if is my child acquiring language? Will they acquire language? These are questions that we get all the time.
Great. Remind me if I haven't answered one of those questions
Yeah.
as I go. So essentially, generative language is the idea that you cannot teach every single skill to somebody. You really need to teach them the foundational skills to fluency so that when they're presented with a new context, a new conversation, a new maths worksheet, a new maths word problem, that's often where we see challenges come up, or a comprehension passage, that they can pull from their fluent skills, combine them, and now they can tackle that new thing that they've been presented with. So that being said, we really need to make sure that these learning contexts, because really that is what a therapeutic environment should focus on. This is about learning. It really needs to target those foundational skills, build them to fluency, and make sure that they're really meaningful to the learner as well. So we do a lot of work in making sure that materials and the instruction and the specifics of the language are tailored to the individual so that they actually care about being there and they want to be there. They want to be challenged. So then to backtrack, if you think about how typical children will, and I use that, neurotypical children will talk about the world, they tend to talk about the physical, the concrete world first. And they use certain ways, certain what we call cues, or what I like to call connector words, to relate different things in the world. So they might talk about how their cat and their dog are the same color, but they're different because they have different names. You can also talk about how things are opposite, or how something is bigger and smaller, how something can contain something else and therefore it's inside. And then you figure out like, oh, this is actually quite a complex skill. So if a backpack, for example, contains a book, the book cannot contain the backpack. So that at this very early age, there's a lot of logic built into using language. But once those foundational skills in describing the physical world are fluent, you then, at least in a therapeutic context, want to check to see what kind of abstract language is emerging. I mentioned earlier that we can't teach everything, and we should not be designing schools as well, or therapies that require every single skill to be taught so that it's almost memorized. We really want spontaneity. We want to see increasing complexity, what we call coherence, making things make sense that provides a natural source of reinforcement for people. And so we want to give them those skills so that they are inferencing and inferring what more complex language means. And I use language somewhat in a technical sense here, but if you think about any type of communication, conversation, anything you might read, anything you might think, this is all coming back to language. And so it's really important to build these skills. And then my colleague, Dr. Elle Kirsten, she published recently on the relationship between building up fluency in these language skills about the physical world and mathematical ability. And there's a very strong relationship there between being able to describe your physical world fluently and your mathematical ability. So it's really, really quite wonderful and really very important to work on. And I have, oh, I'm sorry. Yes, go ahead.
Can I ask a question? So there
Yeah.
are I got some questions and whatnot. So can you describe, so those foundations of language, there are parents who their child is pre-verbal right now. That applies to that as well, right? Because
It
when I
does.
was in therapy with you, right, with Surya, he had already acquired language, but he obviously needed to build his vocabulary. There are kids who are kind of in that pre-verbal stage,
Yep.
if you will. Talk to me about kids in that stage. I get actually quite a few questions from parents about that. My child has been in therapy, they're nonverbal. And a lot of parents I find are in speech therapy, but just curious your
Yep.
observations on that. It's the same construct, different construct.
It is. So at that age, or what I like to call those learners sort of emerging language learners. They're probably stronger at following your instructions, and they're listening. They are paying attention to what you're saying. And so what I'm about to recommend is going to sound very odd, and it's going to be potentially uncomfortable to go about your world narrating what you see, what you hear, what you feel, what you smell, what you taste. But really, you want to model as though you're giving them a rule book. Here is how you can talk about the world around you. And so you'll label very clearly observable things for them. But doing that, you'll use that specific language, talking about how this is the same. Oh, look, your pencil and your book, they are the same color. That's how they're the same or similar. So really it comes down to almost being like a I think of it like in a movie where somebody is narrating everything that is happening. That's really what you want to be when you're around your child. Now, certainly not all the time. That would be exhausting, but maybe you're going to pick a particular activity. Maybe it's during a TV show that your child loves. You'll talk about the characters, what their names are, the fact that they have different names, they're doing different things, wearing different things. You know, there are all sorts of ways that you can notice the foundational language skills that you would like for them to pick up on.
Very interesting. And, a lot of parents ask, will my child talk? Do you believe like most children will ultimately talk if there's a focus on it, or do we not know yet, like all of the pathology? Because what I've seen, and I just having talked to a lot of parents, is if a child is pre-verbal or nonverbal, they're focused on speech.
Mm-hmm.
And I've met parents who are in speech therapy, but they're not in an ABA therapy. And maybe the belief is, okay, I want my child to be verbal, so I'm in speech therapy. But like in theory, you need to be in both therapies. Those are different things. And in order to, for if the goal is to acquire language skills, because there's I get some confusion around that when I talk to parents. Speech
Yeah.
therapy versus ABA.
Yeah, and and I'm speaking a little bit out of turn here, but within speech therapy, there are certain specialties. So there are speech language therapists who will really specialize on feeding, for example, or they might specialize in more social skills. So it really depends on, who you're working with and what your goals are. And and the other thing as well is just knowing what resources are around and who is trusted. So I think that might play a role in it. But at least with, and this is anecdotal here, but at least with in my experience with the very little ones, or even not even just little ones, but I have a student right now who he's 13. He didn't speak until he was 8. So I use little as a very general term here. But speech language at that level seems to focus a lot on the articulation and just how to make the sounds. And that's not something that I'm versed in. I'm not teaching students how to form the sounds, how to form the words. I'm teaching them how to use the words and to use the sounds in ways that are meaningful and really expand their world.
Very good. Thank you for that overview, Sophie. Jen, let me ask you about ABA and behavior therapy. You're really an expert in it, and I know when a lot of the parents that I interact with, they are in an ABA therapy program. They may have a certain number of prescribed hours. Talk a little bit about maybe what a parent should be looking for in terms of knowing, is this therapy working or not? Because I do see frustration with parents sometimes in terms of saying, is like, I'm not seeing any progress. I've been doing this for 6 months and, they're not talking yet. There's been some improvement, but they're not talking yet. How should a parent view the journey of ABA therapy, and just some to help parents get some comfort around how to judge, is this therapy working? Is it right for my child?
Hmm. Yeah, it's a really good question. I think that my first recommendation would be to fully understand what it is your BCBA is setting up as far as programming goes. Get as well versed as you can in the goals that the BCBA has written and why they wrote them for your child. And then you're going to have caregiver goals. And so I would try to fully understand why those goals were written for you and what the big picture is,
So
right?
Jen, sorry, not to interrupt, but I just want to make sure it's very, very basic for any parent. The goals, when your child enters an ABA clinic, there's
Hmm.
going to be a program for them, and
Yep.
that will have goals associated with it. And those will be created by the clinician. And as a parent, you should know what those goals are, basically, is what
Hmm.
I'm saying here.
Yeah, and your goals will be generated from an assessment tool. So, for example, there's an assessment tool called the VB Map, Real Behavior Milestones and Placement Program. And essentially, your BCBA will be probing certain skills, right? That depending on your child's level, they should be displaying in some way, shape, or form. And so they're going to be marking on what they call a grid where your child is as far as hitting those milestones. And then they're going to build goals that fill in any gaps that might exist in that milestones grid. And so you'll want to understand that that's where those goals come from. You may even want to understand the assessment tool itself, right? And why we're even pulling those types of goals. And I think that if you're familiar with the programming and if you understand why you're working on stuff and how you play a role in meeting those goals, you can fully understand if your program is working, right? If you
And
understand how they're taking data and what that
yeah,
data means.
maybe that's so part of that is parent training, right? And as part of, if you're in an insurance-backed therapy program somewhere, which a lot of parents I interact with are, odds are that there is a portion of the program allocated to parent training,
Mhm.
where the clinic is actually reimbursed by your insurance company to offer you training. As a parent, you have to engage in that, but what is it that you could learn in that training program potentially?
Oh, anything you want, and you should be really vocal with your clinician, your clinical team about what you want to learn. So, I think that sometimes caregivers feel like, well, this is just the curriculum, and my BCBA is going through the basics of whatever functions of behavior. And so I'm going to sit and I'm going to listen to them talk about this. And sure, we'll work on this parent training goal. But I would be vocal about what it is that you want to get from the parent training sessions and the things that you're really struggling with day to day and how the parent training time can be as valuable as possible to you.
So, for example, I mean, just to use a concrete example, let's say you're a parent and you reviewed the goals, you have a parent training session, and you're wondering, you're 3 months into therapy, and you're wondering, hey, I haven't seen my child talk yet. I haven't seen them respond to their name yet. Maybe that was a goal. Um, these are all things that are fair game to ask of a clinician, right? I think some parents are a little shy because they don't know the
Mm.
science of it or whatnot, and they're just like anecdotally observing, but it's okay to ask anything.
Oh, yeah. I would ask. Yeah. I would say don't feel like you're a burden to ask. And if you don't fully understand the way they're explaining it, it's a BCBA's job to explain it in a way that you can access it.
Yeah. So I think that's a very important point, is that, your clinician, wherever you are, you should be a partner to them, but you should not be shy about asking questions. One great thing about Sophie, who is our clinician for a meaningful period of time, is she was always willing to answer any question and always provided us with tremendous data. And it was very
Hmm.
easy for me to see that my son was making progress through this therapy, right? And
Hmm.
and that for a parent, I think, is a really important thing. Yeah, I'll tell you, various people communicate in different ways, right? I think Sophie is a very good communicator. There's some clinicians where you have to ask them in order to get the information that you want when you want it. So, like I tell parents, like if you're having a moment of anxiety, ask the question. Like
Hmm.
that is probably a really good thing to do. It may make you feel a little better to know that response. And I can tell just from TikTok that a lot of questions don't get answered because we have parents in therapy, and I'm just like a parent. I don't know the clinical side of this thing, and those questions aren't being answered, or they're not getting answered in one way or another. So I always wonder, have you asked, right? And if you haven't, maybe you should, right?
Yeah.
Yeah, I want to go on and look, we're going to try to finish in about 30 minutes. We have 12 more minutes left, and we have a bunch of people on the live here. And I hope it's not a decent enough experience, but I do want to talk a little bit about outcomes. So one other thing that I get from parents a lot is there's a ton of anxiety, and I certainly felt it when my son was diagnosed, where like, is he ever going to talk? Is he ever going to engage? Is he going to improve? And to be honest with you, one of the things that really helped me is I met a clinician who gave me some perspective. They said, look, nobody knows, but I have seen kids improve through therapy. And I can tell you the reason I post my TikToks, and my son tells me he wants me to post them, and he's proud of his progress, is to show parents what can happen. Okay. And so there are good outcomes in therapy. There are kids who don't respond as well to therapy. Those are all real things. Like nobody can say every single time that everything works exactly as you want. But maybe for you, you guys have been in the field for a while, you've seen a lot of kids. Give some perspective on what you see, like on trajectories of kids and what should be the general expectations of a parent, right? Like that would be great, I think. Maybe Sophie, we can start with you. Like how a parent should think about progress and outcomes for their kid.
Sure. I have to preface what I'm about to say, though. I'm in a private pay model only. So the assessments that I use do not come from the insurance company. So I have a bit more freedom in what's selected and why, and I don't have to separate what might be labeled as academic from what might be labeled as therapeutic. It all comes together. So and also I use a different measurement system than what a lot of practitioners in the field will use. And some of that comes from the insurance companies as well. They want to see the data presented in a certain way. So practitioners are kind of held to the insurance standards. And, so it's always good to question that as well. That maybe it's not the practitioner, it's what the insurance requires. But as far as outcomes go, I mean, I'm looking at learning in real time. So I'm looking at learning across the session, between sessions, and then across programs as well. So I want to see, am I getting untrained things that are just emerging because these foundational skills are fluent? I also, I mean, again, with a mole son, I did a little pre and post test. So I was able to look at, where he was when we first started. And then after 20 hours of this type of instruction, I did another test, the same test again, to see his growth. And it was huge. It was grade levels of growth that he made. And he worked very hard to get there.
Yeah, and
Yeah.
so I give you a framework, and that's so what I tell parents is like, that I've had experiences in therapy where there's pretty fast response to therapy with the you know, and Sophie's was an example of that. It may have been the right therapy, the right time, right clinician, all of those things, right? There are other times where the progress is more incremental, but it does happen. Like generally speaking, I have found positive results in therapy. The rate of change in the child, I've seen different things at different times. And so the way I've set my expectation is that, look, I want to see progress, but, and what I want is some data or some information on to make me
Hmm.
feel comfortable that there's progress being made. And my expectation is over time that we do see that. That's the way I set my expectation, right? I don't say, oh, well, this is exactly how much and at this time, because
Yep.
I think neural networks in the brain and development are unpredictable, right? In some ways. Is that a
Yes,
fair way to frame it?
yes. And you bring up a good point that within this therapeutic relationship, it really needs to be an alliance. It really needs to focus on the relationship first and foremost, because if you have an individual who's there who really doesn't want to be there and they want to be doing something else, um, the clinician really needs to look at that and find out why that is. That's so important. So yes, there are these other kind of, softer skills, maybe harder to measure skills that are happening, but you really do want someone who is ultimately going to accept that they are that they're uncomfortable, that they might even be a little bit anxious, but they really want to try the hard thing anyway. And you want to get to that point. So yes,
And
assent is
like
a really,
frustration. Like sometimes you're gonna have a tough therapy session because you're
yeah.
reaching a point of frustration with the child because they've hit a, they've made progress, but now they're being challenged more. And
Yeah, and you know what? So it could be so much frustration that you as the clinician think, oh, we pushed a little bit too far, but we've discovered something now. Now we can make a change. Or we push just enough and hey, buddy, look what you did today. you absolutely crushed it. You did something you didn't think you could do. So
Yeah,
it's going to depend, but that relationship is going to be first and foremost. And if you're working with a child who's not able to communicate at that level, then you want to rely on the parents for that kind of feedback too.
yeah, I'll just tell one sidebar about that in terms of progress. Like sometimes progress is being made even when you see bad behaviors. Like
Yep. Hmm.
there's these
Still learning.
concepts like, yeah, extinction behaviors and things like that. I remember one time, I was in a session and I thought this when Sergio was really young, when he thought he was making progress. And it was just like the whole session was yelling, screaming, and crying. And I thought to myself, what is going on here? Like, is this a terrible therapy session? Are we moving backwards here? And I reached out to my clinician. They said, look, I can't say for sure, but I think it's an extinction behavior. And over the next month or two, I think you'll see improvement in some of these things, right? And sure enough, that did happen. But like as a parent, I would not have known that if I hadn't talked to, because as it appeared, like, and then I've seen other sessions where it looks magical, like he's interacting and it seems perfect. But therapy it's not like that. You don't judge it on that immediate session. You have
Right,
to
right. Yeah, it's not
data.
linear.
Right. It's not linear.
Hmm.
Exactly.
Hmm.
So that I think is a key point for parents here is like a lot of parents I think either give up or lose some hope because they don't see enough progress immediately. And I really encourage parents that I interact with to not fall into that category because you this is a long process and over time you will see results, but it just may not be that day. And it's kind of hard. Like that's it doesn't seem fair because this is not something that every parent has to contend with, but when you do see results, it's actually very exciting as a parent. So,
Yes. Yeah. And it's for a parent to watch your child have such a hard time, I mean, that just pulls at your heartstrings. That is incredibly difficult to watch. So I do recommend having a good BCBA, a good trusted relationship with them so that they can help you through that, because that should be a part of what this parent training and parent coaching looks like. So that you can weather those storms, because it can be, parents will have a lot of worries. What if and it's a lot of what if statements. What if I'm doing something wrong? What if this is harmful in some way? And it's not that the question is bad, but you want to make sure you have somebody to hear the question and help you through it.
very good. Jen, same thing. How to look at outcomes, and again, I know you've dealt with a lot of younger kids. I do meet a lot of parents who are in the 2, 3, 4, 5 age category. You know, and just curious, what from a parent perspective when we're thinking about outcomes and the journey through therapy, so many hours per week, what to think about and what to expect.
Yeah. I first want to sort of piggyback on what Sophie was talking about there and you, Amal. And if there's one of those tough sessions and there's a lot of behaviors, hopefully you have a clinician who at the end of the session is sort of doing a recap with you, like, hey, I know it might have sounded a little bit crazy in there. This is what was going on. Right. So hopefully there's not a big mystery there where somebody has to call the BCBA and be like, we had a tough session. I'd like to know what went on. Hopefully you have a practitioner who's able to sort of regroup with you at the end. And to move into the outcomes discussion, I mean, for early learners and with that early programming, I think that the dots should connect, even though these are really early skills, you're building a foundation here. It should still make sense to you why you're working on this certain behavior for the big picture, for the long term. So, for example, if, during assessment, like during the initial phases of treatment, where you and the BCBA are trying to figure out what are we going to work on here? What are our big concerns? And let's say they asked you, like, hey, in 5 years, what would you hope this looks like at home? And you tell your BCBA, I'd really love to just have a conversation with my kid about their day. I would like to just ask them what they did at school, and I want to be able to have a back and forth, some reciprocity there. It should make sense to you why, even at like a really early phase of treatment, you're working on something like recalling events or something like that, right? And it should be connected for you if you aren't able to connect it yourself, that like, hey, this is one of those skills that we need to get to that thing that we were talking about during the initial phases of treatment here, which is we want to be able to have a conversation that's really complex and layered. So a lot of what Sophie works on, right? So I think that's what I think about when I think about long-term outcomes for early learners, is that it should still make sense where we're going.
So I think the perspective you're getting, and this is kind of the message is for parents is, uh, engagement. Ask questions of your clinicians, and if you have parent training time, use it. If you're in a private pay model like Sophie has, you can design that with the clinician in many cases. And the insurance side, they reimburse for that. The clinics are supposed to do it. And so that is part of the program. And then in terms of like how you feel, that can help the process, because there are moments where you don't feel like there's a whole lot of progress being made, and there may be moments where you're very excited. And to smooth out the emotion of all of that, I think talking to the clinician is the best way, right? Like, rather than the anxiety can build up. For perspective, I would also recommend one other thing I'll mention is talk to other parents. I mean, the reason I started posting on TikTok is I started with the reverse chronological approach of my son doing a teenage rant about wanting to watch R-rated movies, and he's 14. And I posted that, oh, he was nonverbal when he was 3. Now, there's a lot more like therapy and things we're going to be doing with him over the upcoming years, but to get from where he was to where he is, and the pace at which he's ramping, I'm feeling good about things, right? And I want other parents to feel that way. Basically, to feel like, okay, you know, like there's hope and potential in my therapy. Okay. So listen, we're getting close to time or at time. We're still trying to figure out the right format for this, whether live or Zoom. It seems like live probably is an easier format. So we're going to try to do more of these. Because I don't have it properly set up Q&A, send me any questions you have, and if we can answer them and I can get you in touch with Sophie or Jen, I will. But otherwise, we'll try to host more lives here in the not too distant future. Okay. Thank you, Sophie and Jen, very much for sharing
Thanks,
your thoughts
everybody.
today. Thanks to all the parents for joining as well. Okay.
Bye,
Thank you very much.
everybody. Take
Bye.
care.
Bye.
Bye.